So hi guys, so welcome to my another episode of Vlog Media. This is Mark, and for today we're gonna talk something about medicine. So something about related to medicine. So as you all know, summertime has already been over, and it's already the start of our rainy season. And actually, we're going to talk about something about diseases in or probably acquired during the rainy season. So let's bring it on. So in the Philippines, there are actually two main seasons or probably climates. One is the summer, which typically runs from January to June, and from June onwards is what we call the rainy season, because predominantly it rains from June to December, and there's actually less rain during the month of January to May. And apparently, there are actually diseases that one can acquire when during this rainy season, because raining has been rampant nowadays, and one can acquire these diseases. So we will probably tackle them, discuss them, what are the risk factors, and probably how can we diagnose, what are the symptoms, and one of the most useful tips is how can we prevent those diseases. So let's start with disease number 1. So you'll have influenza, and influenza is typically seasonal, which occurs in some other countries during winter times. However, in our country here, in the temperate country of the Philippines, it usually occurs during the rainy season. So it is usually caused by, most often caused by viruses called influenza. So we have two types, the influenza A and the influenza B. So which influenza A or B, doesn't matter, one will get influenza. So there are actually, there are actually some risk factors to this. There are some people who are more susceptible to developing severe complications of influenza, and there are other people who are actually not getting the severe symptoms. So those who actually get the severe symptoms are the following: children less than 9-year-old, the pregnant individuals, elderlies, and those with comorbidities. So those who have hypertension, diabetes, and those who have chronic lung problems due to smoking, and those who have low immune system, or what we call the immunocompromised. So those are individuals with HIV, and of course individuals with cancer. So once they get influenza, there's a tendency or predisposition for them to develop a more severe disease. So let's now talk about the symptoms. So when you talk about symptoms, symptoms actually vary from mild to severe. So most common symptoms is actually fever. So fever is typically high in these cases, and one actually develops a body malaise or body aches and joint pains around the area, and so usually that's the typical symptoms. Actually, some may get sore throats, some may get runny nose and dry cough, and while others develop nausea, vomiting, and some form of gastrointestinal tract problems such as diarrhea. So, but not everybody have all the same symptom, but the predominant symptom there is actually fever and cough. So apparently, before the pandemic, it's quite easy to diagnose influenza or flu because of the symptoms, and we rarely actually have to go to the laboratory to have the patient or somebody tested for influenza. It usually goes by symptoms. However, nowadays, when one develops fever, of course, obviously we have to do some testing or do some testing to rule out COVID-19. So it actually makes the process more difficult. But of course, if the patient is COVID-19 negative, then of course we are quite sure that he's negative depending on the test, but we're actually favoring RT-PCR for that. And and we can diagnose the influenza. So the next question here is actually, what's the incubation period for influenza? So the incubation period here is, let's see, it's a median of about 2 or 3 days, with actually a range from 1 day to 4 days. So in short, if you are able to catch influenza, then there's an incubation period of 4 days. And by the way, what's an incubation period? So an incubation period is actually the time period wherein someone get exposed to the virus to the time that the one develops the symptoms. That's actually the incubation period. So typically it's about 4 days, and it typically runs for about a week. But again, it depends, because if the person gets an influenza and it turns out that the person is actually immunocompromised, and there's a tendency for the disease to be longer. So yeah, so now let's talk about complications of the disease. So typically, if you're actually an adult, healthy adult, and usually the sequelae will actually be, they usually get better most of the time. However, some patients, or those who have actually the risk factors, are more prone to developing the complications. And the most common complication of this is actually pneumonia. So it can be actually viral pneumonia, it can actually be a bacterial pneumonia, whichever is which, but usually when we see these cases, we usually bring them to the hospital for treatment. The majority of the cases of influenza actually can be treated at home, but it actually is highly infectious too, just like COVID-19. It's highly infectious. And of course, what are the modes of transmission? So for the modes of transmission, actually is composed of 3 primary mode of transmission. So it can be actually touching an infected surface, and another one is actually by aerosols or droplets. So the last thing is, of course, what's in for us? How can we prevent this? Well, just like COVID-19, it spreads that way. So for the prevention of influenza, hand washing is actually very, very important, and social distancing too. If we know that the person has an influenza, we should probably distance ourselves, and probably wearing face masks. And of course, the most important of all is that we should take our yearly annual dose of influenza vaccine. So the vaccine is actually efficacious in itself to prevent severe infections of influenza. So it has actually a efficacy rate of only about 40 to 60%. But still, 40-60% is actually better than none. So that's it for influenza. Now we go to disease number 2. Disease number 2 is common colds. So they're actually very common. They're much more common than the influenza, and is caused by, of course, viruses, typically rhinoviruses, which actually account for most of the cases of common colds. So common colds is actually differentiated from influenza in that the symptoms are actually much less severe, and there are actually less amount of individuals who actually develop complications. But there are actually some risk factors towards this. Actually, those who have risk factors includes probably children, again, the elderly, and of course if you are a smoker, and for those who have asthma. So typically the symptoms will include a runny nose, dripping runny nose, sometimes dry throat or some sore throat, a mild headache, and of course a very mild fever, as opposed to influenza, which actually includes high fever. But for common colds, usually low fever and some body malaise. So this disease typically lasts for about 3 to 4 days, and it has a incubation period of probably a day or 3, and it's usually treated symptomatically, and majority of the case don't really go into admission unless of course you have difficulty of breathing, because some individuals who develop common colds, when they develop common colds and it turns out that they have asthma, they usually have these asthma flare-ups that probably led to admission to the hospital. And the same thing for those who have long-standing pulmonary disease from smoking. They usually require admission if there is actually a flare-up of their own disease by the common cold. And some information here is that for the transmission, actually there are actually 3 types of three ways of transmitting this disease. One is through direct contact by hand contact. If you touch somebody who has actually, or if you shake hands with somebody who has colds, and there's a high likelihood that you will actually develop a cold yourself, because it actually is being shed, and some people actually wipe their nose, and if you shake their hands, then there's a high likelihood that you will get one. Actually, hand washing is actually very, very important preventive measure to combat colds, and there's actually a study done, I think that was in 1980, where I think there were actually about 8 individuals whom actually had exposure when they washed their hands with a sanitizing lotion. None of them developed colds, while the other group who actually didn't wash their hands, I think about a third, if I'm not mistaken, of them developed colds. So it's very important that hand washing is actually a preventive measure against these common colds. Another way of transmission is through small particle droplet. So the problem with small particle droplet is that they're small, and when somebody sneezes, and of course the droplets become aerosols, and they can be airborne for some time. They won't be airborne forever, but they're going to be airborne for a period of time, say for hours probably. And the other one is actually large particle droplets. So yeah, because they shed viruses in when you have runny nose, and that's one way that it can be transmitted. Is there a vaccine for this? Probably no. There's no vaccine for this. But the good thing is about this, actually, no one almost dies from common colds. Well, almost. But take note, there are actually some complications of common colds. These include pneumonia. When you have you can have actually a lung infection, but actually it's not very, very common. The other one is actually infection in the ears. So one can develop infection in the ears from common colds. And of course, sinusitis, which is actually a bacterial infection. It can also be a complication of common colds. So when somebody tells you have a flu, it's usually not a flu. If it's actually the symptom is really very, very, very mild, then you have more likely runny nose, then that's actually a common cold rather than a flu. So flu is a different story. It's actually a more severe disease and can be debilitating to some individuals. But for a common cold, it's usually benign, and majority of the cases actually are they get well in an unremarkable way. So we're done. Let's move to disease number 3. So rainy disease number 3 is actually dengue fever. So if you're not familiar with dengue fever, it's actually a fever that many individuals here actually acquire during the rainy season. And it's actually special because unlike influenza and common colds, which is actually transmitted through droplets, you won't really get infected directly from a person who has a dengue fever. Now what really makes it special is that one can only get infected with a dengue fever or dengue virus from a mosquito bite. So what really happens is that there's a certain species of mosquito which is actually called Aedes aegypti, which I'll provide in the picture. Here's the picture. So this is actually the picture of an Aedes aegypti mosquito. So as you can see, the typical features of this mosquito is actually the legs. So as you can see, this is actually a striped color legs with alternating black and white bands. So if you happen to meet this mosquito, there's actually one thing you can probably do. You can either kill it or probably
run.
That's actually Aedes aegypti. And actually what it does is that it will actually bite a person with dengue and probably transfer that bite to someone who has not have a dengue. And what will happen is actually the mosquito will act as a vector. It's actually a transporter. So it really transports the one infection to the next. So it's actually a vector-borne disease. That's what we call it, a vector-borne disease by a mosquito. So actually, the incubation period typically is actually about 3 days, probably a week. And the symptoms is actually fever at the onset. So the fever is actually typically a high-grade fever with body malaise and joint pains, and there's actually pain at the back of the eyes, and it's actually divided into 3 phases. So for the 3 phases, first we will have the febrile phase. So the febrile phase is actually when the person develops fever and all those joint pains and body malaise. Typically lasts for about 1 or 3 days. Then it will actually move towards the what we call the critical phase. Now that's really critical, as in critical. So for this phase, that's actually critical in a way that if you can imagine, you have your blood circulating towards your body. So what's going to happen in this phase, that the fluids inside your blood will tend to leak though. So it will tend to leak away from your blood vessels. It's going to make you dehydrated because you will have one low volume, and of course this is where symptoms such as low blood pressure, increase in heart rate, and all the dangerous signs such as change in sensorium and abdominal pain occurs. This is actually the very critical phase, and typically patients are actually admitted in this phase. Typically it lasts for about 3 to 4 days actually before it runs into what we call the convalescent phase. So during the convalescent phase, actually the fluid that leaks out of the body, okay, from the blood vessel will actually slowly return to the blood vessels, and one indication of that is that patients are actually getting better, that the fever is actually lowering down, and there's actually a presence of a rash. Okay, it's what we call a Herman's rash actually, and it's actually a very red rash. It looks kind of scary, but actually it's not. It's an indication that actually the patient is getting better from dengue fever. So what actually are the ways to prevent this? Well, one way is actually decrease the breeding ground for mosquitoes. So it's very important to fumigate, and if we have actually pots in our houses which actually can be filled with water during the rainy season, it's actually good practice to put them upside down so they won't be breeding grounds for mosquitoes actually. Another tip is actually putting mosquito lotions when actually you go out, especially to dengue prone areas. It actually will prevent the mosquitoes from actually coming in and biting you. And of course, lastly, do we have any vaccines for this? Well, yes, we did before, but actually we ran into some issues, and I hope that there'll be actually better vaccines in the future. So let's now go to disease number 4. Oh, 4, there you go, 4, yeah. For rainy disease number 4, it is actually leptospirosis. So leptospirosis is a disease which you can get in a tropical country like the Philippines, where it commonly rains during the rainy season, and most often it floods. So it's usually acquired from a bacteria which is actually a spirochete. It's actually a spiral type of bacteria. It looks like a spring, and it is actually highly motile, and it can actually go inside our mucous membranes and through abraded skin. Yeah. So yeah, the funny thing about this is that it is actually transmitted by an animal. Actually, not the animal per se, but the urine of that animal. It's actually from rats. So what actually happens is that the bacteria and the rats actually live together and stay in the urinary structures of the rat, and it doesn't really affect the rat at all. But so it's actually I don't know, I think they don't really harm the rat, but what it does is really harmful to humans. So actually exposure to rat urine infected with leptospira is actually highly highly contagious, in a way that one may be at a high risk of developing leptospirosis actually. So for the incubation period, it's actually about 3 days to about something like 10 days, and usually the first symptom is actually fever, and the fever is actually accompanied by actually redness of the eyes, which we call conjunctival suffusion, and of course body aches, and it's more pronounced over the legs. In the cuff region, it's actually more painful in the cuff region. And actually most of the case of leptospira is actually uncomplicated, but there are actually a small fraction of individuals who actually develop such complications. This is actually the second phase of the disease, which is actually the immune phase of the disease, wherein actually it usually attacks the kidneys, and many patients develop kidney failure and actually yellowness of the skin, which we call jaundice. And of course, the most dangerous symptom is actually bleeding in the lungs. So yeah, how can we prevent leptospirosis? Actually, there's no vaccine for leptospirosis, but if you happen to have have waded in the floods, or probably have an abraded skin, and you came into contact with the flood water, or actually you were wading in the floods, you were wearing safety boots, but actually the flood water kind of splurts in your eye or in your mouth, you can actually see your doctor in order to, so that the doctor can give you a medication, which is actually a prophylaxis against leptospirosis. So there you go, folks. So those are actually 4 common rainy season diseases here actually in the Philippines. So what's really important is actually you take care, and actually prevention is actually better than cure. So if you like this video, so please hit that like, share, comment, and subscribe, and hit that bell notification icon for more videos to come. So see you in the next video. Bye!